And as you know that this is the first hybrid kind of event. So today, the last count I understood about 1,000 people already have logged in order to witness not only the inaugural program, but also I think throughout the next 3 days, many people from all over the world, they would be participating virtually in this event. And I would like to say namaste to all those colleagues who are witnessing this event virtually. Friends, ladies and gentlemen, the COVID-19 pandemic has led us to a dramatic loss of human life, and it is presenting an unprecedented challenge to public health, food systems, and also the world of work. The economic and social disruption which has caused by this pandemic is devastating. I think nobody is going to dispute on that. Tens of millions of people are worldwide are at risk of falling into extreme poverty. Millions of enterprises are facing an existential threat. Nearly half of the world population, that is 3.3 billion people, global workforce, are at risk of losing their livelihoods. We are almost 7 months now since the pandemic had been declared in March this year. And if you look at the origin, it goes back to November 2019. And during this period, the infections and deaths had been really devastating. And even today, in November, almost we are at the end of November, looking back, we are only seeing the acceleration of the infections and also the fatality through new waves of infection worldwide. As you all have heard, while we are sitting here, the Europe and US and some other countries are already talking about wave 2 and wave 3, and they are going for lockdowns. We don't have a very specific medicine for treatment in the given scenario, and the vaccines for which we all have very high hopes looks like we are almost like 6 months to 1 year away. So with no availability of the vaccines or widespread immunity among the communities and the populations, only public health measures can reduce transmission and control outbreaks. So the key takeaway is the need for preparation for the upcoming months and into the future. The COVID-19 pandemic is here to stay. So we had to better learn from it to prepare for the next one, because there will be another probably sooner than we assume or imagine. India's infection trajectory so far is looking comparatively comfortable, but learning from the experience of Europe, we cannot squander the hard-fought gains of lockdowns by the carelessness called pandemic fatigue. The transition is definitely going to be not very easy. It probably is going to take a very long time, and probably it is not going to be fast as we wish. But with all what we have, we had to give a serious try. Work from home to work from office, that is especially true for the high-tech industry, and study from home to back to school, and work from home to work at field, are necessary for us today like a fresh air. We need to steadily but safely open all sectors to avoid the pandemic fatigue and possible larger damage which can happen due to isolation. We should keep a close eye on every spike and act pinpointedly rather than imposing the general lockdowns. Going ahead, we need to give focus on public health to avoid damage. Swachh Bharat, which has been proclaimed in 2014, it should not remain just a slogan, which is going to be written on the walls or which is going to be transmitted by the PR Department of Government of India. We had to take a pledge as a citizen of this country and citizen of this world to strive for better hygiene. Collaboration between public, private, healthcare, and all other relevant industries is going to be very vital, and change in behavior is essential in order to convert this pandemic as an opportunity to improve our preparedness to future healthcare catastrophes. It reminds me that once former World Bank President Jim Kim has called or coined a cycle called panic, neglect, whereby the terror created by a disease outbreak recedes, attention shifts, and we let our vital outbreak fighting mechanisms to atrophy. That is what happens. I hope from this particular pandemic we will learn and we will not go into that mode of panic, neglect. Let me pronounce clear and loud here that this is not the last pandemic. Some like Mr. Gates are calling COVID-19 as a 100-year event. We might come to see the current pandemic as a test run for a pandemic that is going to probably arrive very soon with even more consequences. If you can imagine a disease that is going to transmit as readily as COVID-19 but kills multiples of those infected and disproportionately harm children, that is going to be a big catastrophe. So we need to start our preparation now, today, for our next public health emergency or pandemic or epidemic. I don't want to be a doomsayer or create unnecessary fear here, but at the same time, we should not remain blind to the obvious. Complete freedom from infection or a disease is a mirage. Nature is going to continuously strike at unpredictable and unforeseeable way. If you look at the statistics, from 1970, world has discovered more than 1,500 different new viruses. 1,500 new viruses. And 70% of them are of animal origin, or how we call it as zoonotic origin. And some of them, like Ebola or the current pandemic COVID-19, have created the havoc which need not be told to you because you have witnessed it. And this proves the case for strengthening the world's pandemic response capacity at the global, national, and local levels. COVID-19 probably has made the case even more compelling. The economic disruption which was caused by COVID-19 pandemic is estimated to be something between 9 trillion to 33 trillion. That is probably many more times than a projected cost of preventing the future infections or the future pandemics by investing into public health care. We need to invest into building better healthcare system, and at a society level, we had to improve general hygiene along with other pandemic preparedness measures to avoid or to reduce the impact of ever-increasing, highly contagious, emerging and re-emerging infections.